Self-care is one of those things we hear such a lot about, to the point where you're just thinking, yeah, whatever, bit of self-care, yeah, of course I'll do that, tick the box, tick. But do you know what? There's so much more to it than a lot of us understand. It goes so much deeper than having some chocolates and watching a bit of TV. Although I do like some chocolates and to watch a bit of TV, we can go a lot further with it. And there's so many things that we can do that are so simple that are really, really beneficial to your well-being, and to help you to recover from chronic pain. So my name is Lindsey Ford. I'm an occupational therapist. I've been working in the chronic pain field for about 9 years now, and helping people to recover from chronic pain by helping them to change the messages that their brains are sending out to their bodies. So what we're going to talk about today is self-care. I'm going to go into it in much more detail. So we're all familiar with the basics, aren't we? Which is about the physical, nourishing your body physically. So having a good diet, a balanced diet, making sure you drink enough water, making sure you get enough sleep, making sure you do some exercise and move and that sort of thing. Yeah, and they're kind of the fundamentals that most of us are aware of. The next stage, I would say, is about nourishing your mind. So allowing yourself to have some time to nurture yourself. So most of the people that I work with don't allow themselves this. They don't allow themselves any me time, any quality me time, because they're so busy running around after everybody else and dealing with everybody else's issues. Their own needs aren't even in the picture. So what is really, really beneficial is to just take that step back and go, okay, I need to do something for me. Yeah. Because actually, if you don't do something for you, you probably find that nobody else is going to do anything for you either. So it doesn't have to be anything massive. We're looking at, just something little every day. So it could be as simple as going, right, I am going to carve out 5 minutes out of my day to sit quietly with a magazine, or to sit and be by myself and not do any jobs or any planning or any thinking. Maybe I'm going to do a bit of meditation. Maybe I'm going to do a bit of drawing. Maybe I'm going to paint my nails. Or maybe I'm going to have a bubble bath. Yeah, so although these things are kind of bandied around quite frequently, aren't they? Oh, I'm going to watch TV, I'm going to have a bubble bath. It's about actually prioritising yourself and going, this is what I want to do. This doesn't benefit anybody apart from me. And I think a lot of people really, really struggle with this because they're so used to running around after everybody else, that to actually put themselves first for a change, or not even first, just to prioritise themselves on an equal level with everybody else, they feel really selfish to do that. And that is kind of linked in with self-worth and self-confidence and self-esteem and all these sorts of things. So it is part of a bigger picture, but this is a good way in to start chipping away at that and start to go, no, do you know what? You are valued. You are worth all of this attention. You are worth prioritising, and you are worth listening to. Yeah. So what this is doing is it's feeding your brain these positive messages. It's feeding your brain these messages of worth. And that then helps to feed feelings of safety to your brain. The next bit I would say is about setting boundaries, learning to say no, learning to make your rules, learning to go, do you know what? That's not how I want to do this anymore. That doesn't work for me. And again, something that a lot of the people that I work with and a lot of people who experience chronic pain really struggle with, because they're just not used to doing it. They're used to going, yeah, of course I'll do that. Yeah, oh yeah. I've always wanted to look after your 20 children and not rest all weekend. That's what they're used to doing. And that's the sort of people who I see a lot of. So working out what actually you like to say no to, but you don't, you say yes to. First of all, being aware of that, and then working out how you're going to do that, how you're going to play it, what boundaries you need to set for yourself, whereby it's usually about relationships, it's usually about situations where you're like, do you know what, that's not working for me, I need to do this differently. So I need to not see you, or I need to not spend that time with you, or I need to leave when I want to leave, kind of thing, you know. It's making it work for you. And that is about self-care. It's about self-nurture and self-respect, because what you're doing is you're respecting your needs, your wishes. And that's something that a lot of us aren't very good at doing. So self-care goes much, much deeper, much deeper than drinking some ginseng tea. Is that even a thing? I think it is. You know what I mean. It goes a lot deeper than that. And you can take it on to so many different levels. You really can. But that's a really good starting point, really good place to start looking at. These are the things to put in place, and these are the things that are going to help to show your brain that you value it, that you respect it, that you're worthy, and therefore that you're safe. And if your brain feels these things, then it doesn't feel threatened. Then it doesn't need to send out the danger messages, which are pain. Okay, I hope all that makes sense. If you've got any questions, if you've got any comments, just pop them down below, and I shall see you again soon. Take care.